or a friend, some loved one? Who is it? How this goes is, especially in terms of your question, so typically we do care programs around 4 to 6 months for about 24 to 30 visits, depending on what your history, exams, and x-rays showed, okay? That gets packaged in to roughly monthly payments, $400 to $600 per month. We do not take insurance, but we do provide charges and receipts on reevals you can take to insurance companies in terms of how to hold an adjustment, because if there's anything you get out of this is that the power doesn't come from getting adjusted, it comes from holding your adjustment. And especially in the first intensive phase of care, first 12 visits of 6 weeks, your brain is trying to figure out my old normal or this new normal, what actually is normal. So it's going through this period of trying to figure out which one do I kind of settle into. And that's the benefit of getting checked consistently, because we're not basing it off of the structure, we're basing it off of how you actually functioning. And so once the brain is able to actually lock in, oh, I'm functioning good here, this is what functioning good is, this is my new normal, that's when care really starts to expedite in terms of results and in terms of how you are feeling, because you're functioning optimally for days, weeks at a time. So really that question, that's dependent upon your brain identifying that. Typically it takes about 6 weeks for the brain to figure out that old normal, I don't like that. I like this, I'm functioning well, I'm gonna lock this in and now we're gonna go for a ride.
Yeah, this is my actual normal. And so we talked about more of the functional aspect of holding the adjustment and the structural aspect as well. It's because you have to remember those muscles that are responding to the stressor have pulled that misalignment, correct? And so what's happening is when we correct it, what does it want to do? The muscles naturally want to pull it back. But this is why you shouldn't have to be getting adjusted the rest of your life, because as we continue to train these muscles to hold here more than here, when the muscles, or when your upper neck is able to hold the misalignment, or not the misalignment, when the upper neck is able to hold those bones here, we know that the function is accessed at 100% throughout the entire body. And so essentially it's a training program, think of it like that, where we're training the muscles to be able to hold it in your natural anatomic position the way that it was supposed to, not in the stressed out position. And in doing that, there's a big fancy term called disaffrontation. We're not going to go into that. But in doing, I try to keep it very, light. But there's this term called disaffrontation, where it essentially means that when we have this, the body's unable to send signals. And when we have this and everything's functioning properly, those stress load is able to effectively process it. Yep. So it's training the muscles to be able to hold your head on straight.
The brain's training itself.
Yep.
Yeah.
And so you're not doing adjustments on the cervical spine?
So
you are?
Only when warranted.
We are only when warranted.
Based off of the scan. So basically, the purpose of the scan, so like how we're saying how we've set aside time just for people in this group here, if you so do wish, for the next 2 days to do a consult with us in terms of we actually do a scan. That identifies whether or not there is stress on the central nervous system due to a misalignment of the top 2 bones of the neck, in which case that then leads us to be able to say, hey, we can help you, okay? So we need to first establish if there is autonomic imbalance, issue with brain-body connection, but then we actually have to determine your own unique neurologic fingerprint. Okay, and so that, remember when I keep saying like, oh, I'm stuck in this state, I'm stuck in this chronic fight or flight, or I have never been able to clear this issue out. We're actually trying, that fingerprint is what shows you when you're in that stuck state. And so the only time in which case an adjustment is warranted is when that fingerprint pops up again. And if we're doing our job correctly, if we're on the right route, the right path, then that fingerprint pops, the less and less that fingerprint pops up, the better and better your results are, because you're functioning, that healing mechanism in our brain is actually getting to our body, and the requests from our body are getting to our brain. That channel is actually open, and thus the healing mechanism is unlocked and unleashed. Yep.
So in trusting the process, like going back to what you said earlier, it's not going to be a quick relief, it's more of like what's to come for the future. You want the relief for lifetime. Yeah, absolutely. We're not about quick fixes and patches. I always make the joke, there's a lot of things that are way better at getting out of pain like that other than me. Tequila, marijuana, certain medications, right? All these different things are better at patching the symptoms. But what my entire goal is to not just get to the symptoms, is to get to the cause. And getting to the cause doesn't look like this. Getting to the cause looks like this,
right? The care program looks like this. And then obviously, as soon as we get that upper neck stabilized, then the entire goal of care is to keep the neck stabilized so that way you can continue to thrive the way that you were supposed to. Yep.
Mm-hmm. Yeah, the concept is that this should operate like a dentist, in which case you're getting checked for a cavity. It wouldn't make sense for you to go to your dentist and be like, okay, you got a cavity in this back right molar, let's fill it. Let's see you back next week, make sure it's doing good. Come back next week, it's like, you know that same tooth I put a filling in last week?
It's bad again.
Yeah, it's back again, we gotta go put a cavity in. You're like, well, you just did this. And then you come back a week later, it's like, yep, same tooth again, let's just do it again. You're like, I don't know if you're doing your job right.
Right. And I hate dentists. Yeah. I mean, I work with dentists, I love dentists, but that's the reality is like people, when they hear chiropractic, they're like, oh, I love being adjusted. And it's like, why do we love being adjusted? You just sit in the chair, like, I love getting my cavities filled, right? So, getting adjusted isn't necessarily a good thing. Every single time you have to get adjusted, it's a bad thing because there's something bad going on and we have to correct it to make it good. So if you're getting adjusted every single time, we're not doing our jobs.
Yep.
So that's why we teach people to hold their adjustments.
Mm-hmm. And so people come in at a time, once we get them from the place that they're at to this place of health, then we start phasing out just getting checked itself months at a time, in which case they're not coming in just to get adjusted, they're coming in just to get checked for multiple months at a time. That's the whole goal of how this process works is you're at this point, we have to check that often to really see is once the brain is stabilizing it, then once that brain mechanism is flowing, then office visits become less infrequent, in which case a visit is just to get checked, not necessarily coming in expecting to get adjusted. Yeah.
I have a question.
Yep.
Mm-hmm.
Okay, so when you say adjustment, I visualize the whole other chiropractor.
Yeah.
So, and I'm trying to picture the whole two bone.
So your head is not moving.
Right.
There is none of this, there is none of this.
There's no twisting, like
Your head is
like
completely
this,
supported. And so we're not adjusting both bones. Based off the scan, we know that one of the two bones is the culprit, in which case we have to go take x-rays to figure out which one it is.
And there's 276 different combinations that upper neck can be misaligned.
We have to find the particular one for you.
And that's why the process is the way it is. We have to start with a consult, see if there's even a problem there. After that, then we move forward with care because we're expecting to see one of those 276 different combinations that we are trained to look at specifically. And then it's only one adjustment on that particular misalignment that we found, let's say for you, and then we administer a quick and effective adjustment on one of the upper two bones in the neck, and then we have you rest so that way we can get that bone stabilized and start the process of healing.
Mm-hmm. Yeah, when we have, it's not just that bone, but it's that specific joint.
Yeah.
So we actually have to look at your unique joint angles specific to you, not some arbitrary normal or average, specific to you that determines our actual angle that we particularly need to be in. Like I said, your head is not moving at all. There's none of this. Your head's actually completely supported by a table. It's actually the safest way to receive an adjustment because there's no potential strain or stress on vasculature or connective tissue.
And that's why we're called the specific.
Yeah. Mm-hmm.
Does anyone have any other questions?
I'm still trying to figure out how you do the adjustment.
Is it
Yep.
manual or?
I mean, are you
I see.
tapping the bone?
So the technique is called knee, chest, upper cervical exclusive, okay, or specific, which means we're looking exclusively at the upper neck. So what we do is we utilize the knee chest posture where we either turn the head to the right or to the left, and then we administer a correction. Sometimes we hear the clicking and popping, sometimes we don't. What tells us if we did our job is scanning after an adjustment. So that scanner that we use is to be able to make sure that we're doing our jobs.
Keeps
to hold
us
us accountable. Yeah, it keeps us accountable, which is why it's not in a lot of offices. Because in a lot of offices, you're doing one side, doing another side, and it's like, we did our job, you're on your way. For us, we need to make sure that that adjustment is actually doing something into the body, so that way, come down the line, you don't have to keep seeing us 3 times a week the rest of your life. So yeah, it's a knee chest posture where essentially the patient either turns their head to the right or the left, depending on the particular misalignment that we found, and then the rest is from our hands and what we did on the examination, finding exactly what vector and everything that we need, and then we do administer an adjustment to the upper neck. And like I said, sometimes you hear the clicking and popping, sometimes you don't.
It's like a 1-inch flick.
Yeah, it's really quick.
So it's like a scan, then an adjustment if needed, then another scan, just to check if it's correct?
Yeah, so
Thank you.
so the scan measures autonomic nervous system. What it's in depthly measuring is measuring heat. Heat from our blood vessels, which how much blood is flowing to the back of our neck or our entire body. Part of the exam process is actually a full body scan, so we're seeing how the entire system is functioning. We know the control centers are up here, which is why we only address the cause up here. But the sympathetic nerves, we were talking about parasympathetic, sympathetic nerves dictate blood flow. And so that center, the sympathetic control center, is in our brainstem, which thus allows us to be like, okay, we can reverse engineer our way. That's how we know that we're measuring central nervous system function, we're measuring heat. So the way office visits look like. Okay, that's essentially your question. What does an office visit look like? You come in, probably one of us is going to be at the front or in the back. We hear the door beep, we say, hey, how you doing? What's your name?
Nicole.
Nicole? Okay, hey Nicole, how you doing? Great to see you, come back with me. We get you in a resting chair.
We have 5 of them. We have 2 here, 3 there.
In which case you're going to rest and acclimate for 10 minutes. What that does, it removes any variables. You came in from here, maybe you were late from traffic, or you had a stressful day, or maybe it's Arkansas weather where it's 90 degrees one day and it's 60 the next, and
we all know
hailing and stuff. So you come in here 10 minutes to acclimate, reset, zen out. We come get you out of the chair, we scan you, and then if an adjustment is warranted, then there's actually a 20-minute post-rest period, because like you said, how's the brain able to hold it? That post-rest is essential for maximizing hold. Essentially, that's a period for the brain to have no external stimuli, to be like, this is where I'm supposed to be. And then after that 20-minute period, that's when we run the post-scan to see if our actual objective was achieved, keeping us accountable, and also being able to show the patient, being able to be confident the path that we're doing is correct. Because just like you said, there's 276 different combinations of bone can misalign. You can have multiple, out of those 2 bones, you have multiple joints that are not effective, but we're trying to find the one that's going to clear them all. So essentially, like if I'm in golf and I have a dog leg right and the hole is way down there with the lake, those people are gonna take a driver and then a iron and then a wedge and then a chip and a putt to get there. We're trying to take the drive and go straight into the hole. And that's the concept that we're doing. Yep.
Great question. Oh, great questions.
And you said $25, and that's just for getting the test done, or is that more? Is there more to that?
No, so the $25 is just to be able to come in, run the test, see the scan, be able to see if we're confident. In the case that we're not, we refund the $25 back. In the case that we are, the $25 actually goes towards the care program. And it's only $25, so obviously it's not making a big dent on the care program. But the reason why we take the $25 is because, we used to do them for free, and what would happen is everyone would sign up for a consultation, and then a few people would show up. But when people, there's a term that I love. It's when you pay attention. And so when people put $25, it behooves them to be able to show up to the appointment, so that way we can at least just run the scan. And so that's why we take the deposit. So the $25 just goes towards solidifying your spot for that consultation to get checked.
Okay.
Does anyone else have any other questions? All right, my friends. Be blessed. Thank every single one of you for coming out. Mm-hmm. Again, what I'll do, that's my sister, everybody. Say hi, Carly.
Hi, Carly.
Yep. I'm actually gonna be sitting in that seat. I'll make sure I schedule the consultation, give you the paperwork, and I'll write your times exactly on there. Again, it's only gonna be for the next 2 days. So, we'll work out some times that work. I think Dr. Chris is actually gonna be here to answer any questions. Again, please, if you have any questions regarding care or anything of that nature, come to Dr. Chris. He's excellent at answering questions. He knows everything. That's why we're in this together. But I will be back there making sure that I take care of anyone that wants to schedule a consultation, because what typically happens is people all crowd around there, and the people that want to schedule a consultation have to wait. This way, if you have questions, just go to Chris, and then I'll be back there. Okay? All right, my friends. It was great seeing you all.
Appreciate you guys coming. That was awesome.
Okay.